Hi there, good morning.
Hi.
My name is Chris Whiten, I'm one of the anaesthetic doctors, and I'm going to be looking after you today and putting you to sleep for your operation. I just need to have a quick chat if that's right.
Great, yeah.
Okay, so what are you planning on having done today? What are you expecting?
I'm having a knee arthroscopy.
Okay.
Yeah.
And have
I've had this before.
You have?
Yeah.
Okay. How long ago was that?
Last year.
And did you have any problems with the anaesthetic that you had back then?
Not really. I was sick afterwards.
Oh really? That's awful. I'm sorry to hear about that. Do you know if they gave you anything that worked to stop the sickness afterwards? Or?
They gave me something, and then they gave me something to go home with. I can't remember the name, but yeah, it was helpful.
All right. And have you ever had any anaesthetics in the past before that or since
No.
then? No. And has anyone in the family had any trouble with anaesthetics that you know of?
No.
No, not at all. Okay. And otherwise, apart from this, are you fairly fit and well? Any other medical problems at all?
No, not really.
So nothing like asthma, no problems with
No,
your
I just
breathing?
need this knee sorted out.
Okay.
Yeah.
And I just need to ask you about any other medical problems first, if that's all right.
Okay, yeah.
And any other problems with your heart at all?
No.
No blood pressure, heart disease, nothing else?
No, nothing.
Okay. And are you taking any regular medication at the moment?
Well, yeah, for my knee,
What do you
sometimes.
take?
Paracetamol,
Yeah.
sometimes.
Any others apart from that?
Sometimes I take some Nurofen.
Okay. And are you okay with Nurofen?
Yeah,
It won't upset
yeah.
you at all anyway? Okay.
Well, I've got to take it with food. Yeah.
Right.
It's all right.
If you don't take it with food, what happens?
I get, indigestion.
And do you ever get indigestion, like reflux, like heartburn?
No,
acid?
no.
You never had acid coming up into the throat, into the mouth?
No.
Okay. Any allergies to anything at all we might use in a hospital?
Penicillin, I was told.
All right. Were you told what happened when you had it?
No,
Okay. And when were you told that you had
when
that?
I was a kid.
Right. Okay.
But I've had amoxicillin.
When did you have that?
I had it for a cough a couple of years ago.
And no problems at all with that?
No.
Okay. All right. I'll make a note that you've been told you're penicillin allergic,
Yeah.
but we'll try and avoid it if
It's
we
quite
can.
confusing, really. Yeah.
Okay. All right. Any problems with your teeth at all? Any caps or crowns,
No.
loose teeth, any dental work of any kind? Nothing like that?
No.
Okay. And when did you
Why
last...
are you asking me that?
Because when you go off to sleep,
Yeah.
you can stop breathing
Yeah.
if we're not around. We have to put a little breathing tube down.
Yeah.
And obviously to get a breathing tube into your mouth, we have to know if there's any obstacles in the way, any loose teeth or dental work.
All right, no, I haven't got
Nothing
anything like that. No.
Fantastic. Okay. And when was the last time you had anything to eat or drink?
Last night,
What time?
long time ago, about 8 o'clock.
And was that food or drink?
Yeah, I had my dinner.
You made me.
Yeah.
And you've had nothing at all since then?
I had a coffee in the morning.
Okay.
Yeah.
Was there milk in the coffee?
No,
There
no,
wasn't. And
no.
what time was that, to be specific?
That was 2 hours ago, a couple
Okay.
of hours ago.
And definitely no milk in there?
No,
Fantastic.
no.
Okay. I just need to ask you now, have you got any problems with your neck? Have you had a whiplash injury or arthritis in your neck?
No, sometimes my jaw looks.
Okay.
Yeah.
Um,
Doesn't.
does that cause a problem to you?
No, just you can hear
Is
it.
it painful at all?
No,
And
no.
it doesn't affect your mouth opening or your ability
No,
to chew anything?
no, no.
Wonderful. What I want to do now is just have a quick examination of your, what we call your airways. I just
Mm.
want to get you to open your mouth as wide as you can for me. Really wide, stick your tongue out at me. Fantastic. Can I get you to give me a big grin and put your teeth together now? And can you put the bottom set of teeth forwards for me? You're doing it already. That's fantastic. Wonderful. Just relax now. Can you lift your chin high in there? I'm just going to feel your neck very quickly there. Fantastic. Look down to your toes and back up to the sky for me. Any problems in your neck when you do that?
No.
Fantastic. Okay. Everything seems fine there. So what I'll do now, that's all the questions over, is explain what's involved with the general anaesthetic for the procedure you're having today. And then if you've got any questions, you can ask me those later. So when you come to the anaesthetic room, which is a separate room to the operating theatre, and that's where we put you off to sleep before you go in for your operation, we'll put all of the monitoring stuff onto you. So we'll put a little probe on the finger that tells us how much oxygen's in your bloodstream. We'll put a blood pressure cuff on, which I'm sure you've had before, just checks your
Yeah.
blood pressure throughout the operation. We'll put some little stickers on your chest, on your
Yeah.
shoulders, and one just down on the side of your chest there. And that's to look at your ECG and your heart rhythm throughout the operation. Once that's in place, I'll put a little cannula in the back of the hand. That's the sharp scratch on the plastic tube. We'll connect that up to some fluids, because you're obviously feeling a bit dry, because
Yeah.
you've had anything to eat or drink for a while. We'll run those in, 2 injections into there, which you'll feel quite cold up the arm, and that'll be the last thing you feel until you go off to sleep. Okay. Next thing you know, you'll be in recovery after the operation. And during the procedure, because you've been sick in the past, I'm going to give you 2 medications in combination to try and stop you being sick this time.
Hopefully.
Now usually they're fairly effective and it's the best combination we have, so fingers crossed that will work.
Okay.
What I can also do is avoid, there's certain medications that I'll avoid that we know can make people feel a bit sick, so I'll
Okay.
avoid those as well, and the combination of doing all of those things should hopefully see you right and will avoid the sickness this time, so I know it's very distressing if you're sick after an
Yeah,
operation. isn't it?
yeah.
The other thing is it can be a bit sore if you have an operation and no pain relief, so what
Yeah.
I'll do throughout the procedure, I'll give you strong painkillers.
Yeah.
The surgeon will put some local anaesthetic in as well, and those together again should keep you nice and comfy. When you're awake in recovery, if you are in pain or if you're feeling sick at all, let the nursing staff know as soon as you're able to, because the sooner you let us know about those things, the easier it is for us to treat them. Okay. Is that clear? I've rushed through quite a lot of information. So.
Yeah, I remember a lot of it from last
Okay.
time. I'm really worried. I've been watching this program about patients who are awake, you know, during surgery and they feel everything.
Okay.
I'm really worried about that.
Right. I can reassure you quite easily about that. The sort of situation you're talking about is what we call awareness under anaesthesia, and that's when in certain situations we have to give drugs which basically paralyse you for the type of procedure you're having. The procedure you're having today, I don't need to give you those drugs. You'll be breathing for yourself during the operation. You won't be getting any medications to paralyse you. So if the anaesthetic level was to drop to such a level that you were aware, you'd let me know. You'd wake up and I'd pick it up very quickly. So I think it's incredibly unlikely that would happen today.
Okay.
There are certain situations we know where that's more common, and this isn't one of them. It's usually emergency procedures in people who are a little bit more unwell.
Why do they show these programs? Just scare people.
I think it makes good television and people enjoy watching them, that's why. But it's often they're not very
So you're saying it happens,
it can
but it's
happen.
unlikely to happen and you're going to be monitoring it very closely?
In this situation, I'd say it's virtually impossible in this sort of situation today.
Alright,
I can be very reassuring about that.
Thank you. That's great.
Any other concerns or questions?
No, just the sickness really. I mean, I know you're going to try your
Yeah.
best and that's it. Yeah, I just want to get it over with
I
now.
bet you do.
Yeah, I want to have some lunch.
Okay.
Oh, I'm going to get a lift home, but then tonight I have some plans. Can I drive?
You can't drive.
Okay.
What we say is for 24 hours after a general anaesthetic, you need to be accompanied by a responsible adult. So you can't go anywhere on your own, get on buses, you need to have someone with you during that time. No operating heavy machinery, so I don't know if you've got any heavy machinery at home, but you shouldn't have to do that. No driving and no cooking. So that's what we say. So you shouldn't be in control of anything dangerous and you shouldn't be driving for a 24-hour period. You should be at home. You'll feel a little bit like you've had a hangover. I don't know if you drink at all, but you'll feel a little bit like you've got a hangover for about 24 hours, and so you'll probably just want to take it.
So maybe I can just drink anyway then?
No. Again, that's the other thing. We'd advise that you wouldn't take any other sedatives, and alcohol is a sedative, so avoid alcohol for 24 hours.
Okay.
And one last question I didn't ask you about, do you smoke at all? Are you a smoker?
Yeah.
You do. How much do you smoke roughly?
I'd say 10 a day,
Okay.
something like that.
And that's been constant for how long? How long have you been smoking?
5 years.
Right.
Yeah.
Okay. Alright, shouldn't be a problem. So thanks for all your time.
Alright.
Happy?
Yes, thank you very much. Thank you.
Thanks very much for your time.
Bye. See you later. Bye. Thanks.